And I now give the floor to the observer of the Sovereign Order of Malta.
Mr. President, distinguished excellencies, ladies and gentlemen, the Sovereign Order of Malta extends its appreciation for the accomplishments of UNAIDS, the Global Fund, partner governments, and civil society, as underscored in a report to the Secretary General regarding the implementation of the Declaration of Commitment on HIV/AIDS and the political declaration. To effectively bring an end to the HIV/AIDS pandemic, it is imperative for all stakeholders to sustain their momentum and intensify their efforts. This remains a global pandemic, although unfortunately eclipsed by COVID, that has inflicted immeasurable suffering upon individuals, families, and communities. Since its emergence, HIV has claimed the lives of millions. Moreover, it has exacerbated social and economic disparities, further marginalizing the most vulnerable segments of society. In the words of Pope St. John Paul II's encyclical, Solicitudo Rei Socialis, we must face squarely the reality of an innumerable multitude of people, children, adults, and the elderly, real and unique human persons who are suffering under an intolerable burden. Recognizing that reaching the target of eliminating HIV/AIDS by 2030 cannot be accomplished without addressing the inequalities which perpetuate this pandemic, the Order of Malta continues to commit itself to aggressively reaching out to the poorest, most isolated, and most marginalized who are at the highest risk and suffer most from the virus. In 5 continents, the Order of Malta has continued to combat the HIV pandemic with treatment, prevention, and education programs, mindful also of meeting the psychosocial needs of those living with HIV and their families through integrative and holistic approaches. For example, in the Lembe district of South Africa, our Blessed Gerard Care Center, in addition to providing free testing and counseling services, provides life-changing antiviral drugs for people living with HIV in the district, regularly taking medicines via its mobile clinic to patients living alone in poverty and isolation to ensure adherence and prevent treatment failure. Again, in South Africa, mindful that HIV does not just affect those who have been infected, the Order of Malta runs a home in Mendani for children who have been made orphans by the spread of HIV and AIDS. In Kenya, the work of our relief agency, Malteser International, has since 2001 focused efforts on the diagnosis, treatment, and prevention of tuberculosis and HIV/AIDS among the disadvantaged living in the slums of Nairobi and among various tribal groups. In Mexico City, where the percentage of HIV-positive mothers over the age of 15 has increased, the Order continues running transmission prevention programs, managing courses for mothers and fathers, providing psychosocial counseling, and distributing food supplements, enriched milk, and hygiene kits for mothers and babies. In conclusion, we eagerly anticipate fruitful discussions and constructive outcomes as we collectively strive towards a more inclusive and accessible world for all. We express our gratitude for your valuable time and look forward to the active participation and engagement of all stakeholders in this process as we work together towards eliminating HIV and AIDS by 2030. Thank you.